to the fifth, hello everyone, and welcome to the fifth edition EDB Insights session with experts and colleagues, looking at everything to do with equity, diversity, and belonging, and how we can learn from it. So a bit of introduction about myself. My name is Captain Dave, my pronouns are he, him. I am RCOT's EDB manager, and next week it'll be 1 year that I'll be in the post. Also from the RC events team, I have my colleagues Kazdan, Chanel Shockness, and Dagmara Drozdowska here with me. So before we start the discussion, a little bit of housekeeping. This event is recorded, so it can be shared with other members on the RCOT website. We have enabled live transcriptions for this event. So if you would like to see captions, please excuse me, I need to clear my throat. Really sorry about that. So we have enabled live transcription for this event. So if you would like to see the captions on your Zoom controls, click the live transcript and select show subtitle. You can also use the chat feature throughout, and there will be a discussion at the end. So we are really delighted, extremely delighted, I should say, that both Rebecca Swenson and Hannah Spencer will be presenting today. So Rebecca is a senior lecturer in occupational therapy at London Southbank University and PhD researcher. And Hannah is an NHS Occupational Therapist and recently completed their MSc research project entitled A Gender Agenda, exploring pre-registration students' understandings of gender diversity and relevance to occupational therapy practice. Both are among founding members of the recently formed LGBTQIA OTUK network and synthesize lived experience with professional and research interest in LGBTQIA communities. So the format for today, there'll be approximately 40 minutes presentation, after which we'll have a round of approximately 40 minutes for Rebecca and Hannah to answer your questions live. So if you do have a question, please add them to the question and answer box, and we will answer as many as possible after the talk. And to help us with this, if you see a question that you would like to be answered, please click the like button, and the questions with the most votes will be answered first. So without further delay, it gives me enormous pleasure to hand you over to Rebecca and Hannah. Take it away.
Thank you, Kethan. Thank you for that welcome. And yeah, just to say, Kethan, I wanted to say, kind of show my appreciation for all the work that you're doing, bringing equality, diversity, and belonging to our COTs. So thank you for that. Yes. So, as Kethan said, for the next 40 minutes, Hannah and I are going to kind of talk about, well, we're going to give an overview of what we're talking about, but first of all, just to kind of introduce ourselves. I'm a senior lecturer at London Southbank University. My pronouns are she, her. And before I trained to be an occupational therapist, I kind of volunteered in different capacities for LGBTQ charities and organizations. So it's a kind of an issue which is very close to me. And then when I trained as an occupational therapist and started working at Southbank, I started research basically into identity, occupation, sexuality, and gender identities. I've just completed my PhD, which was looking at how people who define as trans, non-binary, genderqueer express themselves through the occupations that they do. And it's important to state that although I very much see myself as part of the LGBTQ community, I don't define as trans, I define as cisgender. And the reason I bring that up is that I can't call myself an expert in this area. The only people who are expert are those who have this lived experience of this. And just to flag up as well, at this stage, we're going to be covering a lot of areas. We'll also be covering some statistics which show the impact of stigma and discrimination on trans people, and they're quite shocking and upsetting. So I just wanted to flag that up now.
Okay, so hi, I'm Hannah Spencer. My pronouns are they and them. I'm an occupational therapist, as Ketan said. I currently work in a community mental health setting in the NHS. I'm also one of the founding members of the LGBTQIA OTUK network. And I guess what brings me here today is my ongoing synthesis of lived personal experiences with professional and research insights. My particular focus obviously being around trans or non-binary identities. And whilst I recognise that my personal interest and my lived experience is inherent in the justification for my ongoing work and therefore highlight that potential for bias, as Ketan said, my MSc research was around pre-reg OT students' understandings of gender variance and relevance to occupational therapy practice. And in the course of doing that project, I established that knowledge and understanding around trans and non-binary identities is tentative among healthcare professionals as a whole. And there's very little in the way of OT specific research or content relating to trans or non-binary folks, particularly in the UK. Despite this, there's a clear need for some knowledge and understanding in terms of trans and non-binary folks accessing the general and diverse services we provide in every context, but also to me a glaringly obvious alignment with occupational therapy because of the reciprocal relationship between doing, gender and the impacts of the environment. So before we started, I wanted to say that this is a huge topic area and could be explored from the perspective of multiple different contexts. Ultimately, each individual person has their own unique experience of gender and gender identity, and nobody owes any explanation for that. So today's session is not intended to cover everything, but hopefully very much an insight session to prompt thought, further learning, and application of some small changes that we can all make to make practice more inclusive.
So for the next 40 minutes or so, we are going to kind of give an overview of the context and why this is important. And, you know, the very fact that you're here today shows that you appreciate the importance of us all kind of implementing best and good practice in our work when working with trans communities. So we're going to touch upon why this is important to our profession, kind of from a legal, ethical perspective, but also, as Hannah said, you know, that link between what we do and who we are and how we express ourselves. And then we're going to wrap up by kind of looking at some suggestions for best practice. Thanks, Hannah.
Okay. So before we start, some definition of terms. So trans is the T, or transgender is the T in the LGBTQIA+ acronym. And in its most inclusive and expansive sense, trans is an umbrella term used by a diverse population of individuals whose gender identity, that's personal experience of gender, is not congruent with the sex with which they were assigned at birth, sometimes called gender incongruence. Going on from that, gender dysphoria is the name for the discomfort or distress that some trans folks experience consistent with that. And trans people might identify with the opposing binary identity to the sex with which they're assigned at birth, or outside of the male-female binary. And just kind of state right from the beginning that being trans is not a mental illness, but has historically been recognised as such. And it was only declassified by the World Health Organization in 2019, which that's kind of astounding to me. So non-binary folks' gender identity falls outside of the male-female, man-woman binary. Non-binary folks may or may not identify as trans. That's, I guess, why you sometimes get people referring to trans and non-binary people, and other people say trans or non-binary people. And I guess it depends on the individual as to how they identify. Being non-binary comes with its own unique experiences and challenges. For example, non-binary is not currently a legally recognised gender identity, therefore there's no options in terms of official documentation, poor visibility in healthcare, and even less in terms of the research content. So cis or cisgender refers to people whose gender identity and expression is largely congruent with sex assigned at birth. And though those differences in cultures and societies worldwide have to be acknowledged, it could be argued that Western society, and definitely the UK as a whole, is assumed cisgender and perceives both sex and gender as binary, as either male or female, which overlooks the needs of those people who are trans or non-binary. And as the slide says there, most appropriate and respectful terminology and language relating to this topic area is persistently evolving, ultimately be led by the person and their individual experiences, but be aware that some language and perspectives, particularly that which medicalizes or others, are outdated and harmful. Important also to note that transition or gender affirmation is an individual process and means different things to different people. It can be social, legal, medical, including hormonal or surgical, and that's a choice. Can often be influenced by access, but a choice, an individual choice, and none of those things make someone any more or less trans. So as occupational therapists, we understand the impact of the environment, positively, negatively, or otherwise, on a person and their occupational engagement. So before Rebecca dives deeper into occupational experiences of trans and non-binary folks, I guess I just wanted to set the scene in terms of the context in the UK and highlight some aspects of the multifaceted environment that are particularly pertinent to today's session. So the arrows on the slide there indicate that multi-directional relationship between each layer of context in terms of influences on practice, but also potential impacts of inclusive practice, particularly when we consider increasingly diverse roles for occupational therapists. So gender identity and or trans status was collected in the 2021 census for the first time. The results of that haven't yet been published, but it's difficult to ascertain accurate data re the amount of folks in the UK who are trans or non-binary. And that in itself highlights those long-standing assumptions of cis normativity in the context of the UK. And some of those are arguably perpetuated by social, cultural, political environments, which reiterate some of those cues, which are either subtle or overt, to suggest that we don't belong. And I guess I'm talking here about things such as trans and non-binary folks' identities, existence, and rights being persistently debated and sensationalized in news stories. I'm talking about the law and legislation that's not always inclusive or protective of us. Example being the government very recently determining that gender neutral or universal toilet facilities in new builds should be provided if there's space, but not at the expense of single sex facilities. And I'm talking about, with reference to affirming care and treatment, which is again something not sought by everyone, extensive waiting lists that breach the NHS constitution that wouldn't be acceptable in any other context, and gate-kept access to outdated medicalised processes and approaches, which reiterate some of that structural discrimination. And this stuff is then perpetuated in wider societal attitudes. It's the stuff that hits the public eye ultimately. And all of this is the everyday experience of trans and non-binary folks in work, in accessing healthcare, in everyday life and occupational context. Don't get me wrong, there are places that are affirmative and celebratory, but alongside those is this persistent kind of questioning of what if, and questioning of safety in various contexts. And that an anticipation of that is kind of influenced by a spectrum of negative experience, be they subtle or overt, microaggressions, ignorance, or intentional discrimination. So what does all of that, what impact does all of that have on health and well-being, quality of life? So some of the broad range of injustices trans and non-binary folks experience are well documented alongside those societal assumptions of cis normativity. And the one that really stands out to me on the slide there is that statistic from the 2018 Stonewall Health Report, around 64% of non-binary and 60% of trans respondents feeling like life wasn't worth living. Furthermore, multiple sources highlight difficulties in accessing mental health support because of a common misperception that it's gender related and therefore requires a specialist service. So we're not talking about specialist services, we're talking about wide-ranging general services and existence. And also highlighting there that cumulative exacerbated impact on trans folks with multiple intersecting marginalised identities. So that's kind of set the scene in terms of the wider societal content. what about the context that we're working in? Surely healthcare settings are inclusive and supportive, affirmative spaces? Unfortunately, not necessarily so. And that's part of what brings us here today. So the Government Equalities Office National LGBT Survey was conducted in 2017 and indicated that 38% of trans and non-binary folks had had negative experiences in response to gender identity when trying to access general healthcare services. The middle statistic there, acknowledging that potential bias of documentation co-produced by Stonewall, which is an organisation with a specific campaign agenda, but that quote in the centre there is from a report published by Stonewall on the health of the LGBT population in the UK, which says that 41% of trans folks said that healthcare staff in general healthcare services lacked understanding of trans health needs. And the third quote there from the healthcare report recently produced by the Transforming Futures Partnership, which is a 5-year lottery funded qualitative research project led by and focused on trans folks in England. The report itself is unsurprisingly pretty extensive in terms of highlighting issues with and barriers to accessing healthcare. That's general and or transition/gender identity related. But I think that quote on the right there really hits hard and ripples towards why it's crucially important that we do something about addressing those negative experiences and gaps in knowledge and understanding. Avoidance of healthcare is in part due to these negative experiences. And it was reported even more frequently by trans people of colour who participated in that same Transforming Futures Partnership project. And this is perhaps unsurprising given societally perpetuated institutional racism, which is reiterated elsewhere with respect to discrimination folks experience on grounds of race, gender, often religious or cultural values and beliefs, and the intersection of those identities. And it's equally difficult to comment on the specific experience of disabled trans and non-binary folks because the research and the data just isn't there. But what is indicated is a higher proportion of trans folks with long-term conditions then don't necessarily seek the appropriate support or kind of preventative screening services and so on. And this is all relevant in terms of the people we work with. We're privileged to work with in our various practice and education contexts, and also our friends, our colleagues, and our future workforce. So I guess I've already pretty much reiterated relevance to practice. But Dowers et al. Posed in 2019 that cisnormativity, or arguably any of those multifaceted normative assumptions of cisgender, heterosexual, white, British, etc., restricts inclusion and participation in occupations, which we know as OTs is fundamental to well-being, and that well-being is integral to human rights. One step further than that then, and well evidenced, is that cisnormativity, or those normative assumptions, restricts inclusion and participation in healthcare, which relates back to that declaration of human rights around access to a good standard of health and as a fundamental human right. The bottom line being that if we're genuinely committed to promoting well-being through occupation, and that occupational engagement is integral to well-being, which is a fundamental human right, then we need to collectively, actively challenge inequities and injustices and make change. It's essentially population level, it's proactive, and it's all of our responsibility. Over to you, Rebecca.
Thanks, Hannah. So now I'm going to kind of just give an overview of kind of what research is out there and why there's such a clear link between kind of gender expression and the occupations that we do. So when someone is born, they are ascribed a gender, so male or female, and this may or may not match with someone's internal sense of gender identity. So for many people, it's quite a neat fit. You're kind of told that you're male and that fits with your gender identity, for example. But if you're trans or non-binary, that isn't such a neat fit at all. So that's kind of talk about gender identity. Gender expression is how we express our gender identity, this innate sense of who we are. And we do that through the clothes that we wear. And also the places that we go to and the things that we do. So in other words, our occupations, our occupational kind of identities link with our gender expression. So for most people, that's an uncomplicated relationship. We can do things that express who we are. But if you're trans or non-binary, it's unfortunately not such a straightforward relationship, because it may not be safe for you to express your gender identity, to wear the clothes that you want to wear, to do the things that you want to do. Culturally, we are so steeped in stereotypes to kind of even remotely stray away from them can cause scrutiny. And for many trans and non-binary people, as Hannah's pointed out, expressing true, authentic sense of self can lead not only to scrutiny, but abuse and violence. Thank you, Hannah. So I'm just going to now talk through the kind of research that's out there. There's not a huge amount, so I'm not going to spend a long time doing that. But just to say that the first bit of kind of UK occupational therapy research was done, I think Jessup was the author in the 90s, and it's a case study of a occupational therapist working with a trans woman. And it's kind of, I think, very much of his time. And it's kind of an interesting paper, but it kind of does err on the side of teaching someone how to do gender. So teaching someone how to be a woman. You kind of wear these clothes, you do these activities. So, and that reflects, I think, kind of society at that time. And then there's kind of a bit of a pause. There's not much research out there at all. And then in around 2012, Brenda Began, who's published a lot of very interesting research, published a couple of papers on kind of occupation for people who define as transgender, so very kind of binary notion of people who have transitioned from one gender to another. And it clearly pointed out, unsurprisingly, that trans people face occupational injustices. And there's a few papers around this time, and then a few years ago, Dowes et al., a paper that Hannah's mentioned, did a scoping review looking at a range of kind of publications, not just from occupational therapy, but using an occupational lens. And it clearly documented that, yes, trans people face occupational injustices, but it also highlighted the very key fact that occupation enables and is vital for authentic gender expression. Now, the past few years, there's been, I think, again, reflecting society's understanding, though don't get me wrong, occupational science, occupational therapy is lagging behind in terms of kind of research in this kind of area, but a more nuanced understanding that trans doesn't just mean a binary transition from one gender to another, that actually non-binary people exist and have very distinct experiences, occupational experiences. So you're seeing now kind of more papers which are out there which do distinguish people's gender identities, because the trans communities are a rich, diverse groups of gender identities. And I think if you were to do research now, I would strongly recommend you don't homogenize people under the kind of the umbrella of transgender. Thanks, Hannah. Oh, those are just some papers there. We've got quite an extensive reference list, but those are some of the more recent papers that I think are kind of very interesting. So, as I mentioned, I've just completed my PhD, which was sort of a 5-year research project working with people who define as trans, non-binary, genderqueer, and looking at how occupation can facilitate, or sometimes if it's enforced occupation, can be a barrier to authentic gender expression. And unsurprisingly, participants talked about how they are kind of occupationally marginalised, face deprivation and alienation. So to give you some examples of occupational marginalisation, the amount of strategizing and labour people had to put into to do activities that are meaningful to them, but to do these safely, was breathtaking. So to give you an example, one participant who defines as non-binary transmasculine loves going to the gym. The gym is a big part of his identity, but he would only go there when it was safe. So very early in the morning, when he could use the changing room without any scrutiny, or with a friend. So he was able to do this meaningful occupation, but not on his terms if he wanted to do it safely. And that constant sense of being vigilant, particularly around, Hannah's mentioned it, the use of toilets and bathrooms. It seems like such a flippant thing, and you know, people really don't sometimes grasp the importance of gender-neutral toilets. The fear of going into a space where you may face scrutiny or abuse or admonishment, or microaggressions, or sometimes full-out aggressions. So that was kind of the marginalisation, and that seeped into deprivation, because sometimes people would not go to the pub that they like going to because they didn't feel safe in the toilets. Although I was interviewing people who were adults, participants spoke of their experiences in childhood when they weren't allowed to play with certain toys, or they weren't even allowed to use the colours pink or purple when they were colouring in because it didn't match their gender identity. And then occupational alienation, doing activities which had absolutely no meaning to them, but it fit in with what society expected of their gender identities to do. So I kind of reference myself here, but I just wanted to flag up, there was this sense of occupational assimilation, which is slightly different to alienation. So yes, people did activities mainly in the workplace or at school, which had no meaning to them, but it kept them safe and kind of helped them evade scrutiny. So it had no positive impact on health or well-being. It was purely done to keep safe, to fit in. And you see that with kind of there's papers which talk about, the experiences of people who'd emigrate to a country, the country says to them, we welcome you, but do as we do, eat what we eat, be like us, and then there'll be no problem. So this sense of having to do occupations to fit in, and the payoff was, well, it's hard to call it a payoff, but they were kept safe. To stray away from doing that meant that they felt at risk and not safe. Thanks, Hannah. So on the upside, going back to this sense that occupations are vital for expression of who we are, and I think that this, Wilcox framework of doing, being, becoming, and belonging really sums this up. When you can do things that are important to you, you have this sense of your being, and you can visualize your future self through what you're doing. To give you an example, one participant talked about how when they were young and at school, primary school, they were asked what they would like to be when they grow up. And they had this image of themselves, which was at odds with the gender they'd been ascribed at birth as kind of muscular, having a beard. But they could sense through this, I think that what they wanted to do was to be a fireman, but they had this sense of their true, authentic self through this activity. So to kind of give you some examples, if you could pull up the next thing, thank you. So I'm stating it absolutely obvious here. So occupation, engagement in meaningful activities was essential to authentic gender expression. And I think what was interesting was that when you can be who you want to be, the nature, the meaning of the occupation changed. So to give you an example, one participant who defined as a transgender woman talked about how pre-transition, when she was forced to live as a man, she would go for walks to exhaust herself, to numb that sense of not being able to express who she was, just to kind of numb away the pain, go for long walks to exhaust herself. Post-transition, when walking as a woman and seeing other walkers who would validate who she was, it was all about connection to her environment. The walk, the environment she was walking in, but her environment of fellow walkers, people around her. So when you can be, the nature of occupation changes. And I think one of the big things was creativity. Now, I'm not talking about doing creative activities like art, drama, music, etc. Actually, some of these creative activities were desperately binary. So a couple of participants talked about how they would go to dancing lessons or join a choir, and it was men over there, women over there. So something which is about expressing yourself was immediately kind of made into this binary box. But when I talk about creativity, I'm talking about the right to be creative in expressing your gender, who you are. And in doing that, the most mundane activities like having a cup of coffee, traveling to walk, suddenly become creative in themselves and inspiring activities. Thanks, Hannah. So there's not yet any publication on trans non-binary from our COP. Hopefully that will change. And but there is this quote which I think is really powerful, that people create identity and meaning through what they do and have the capacity to transform themselves through premeditated and autonomous action. And I would say, kind of maybe for the word transform here, it's express in this context. But we know that what occupation can do to our sense of self and being.
Yeah, so I guess I included these images on the slide there, these graphics on the slide there, because my brain works in a very visual way, but I can't help but listen to what Rebecca has to say or read the research or anything that's out there and not think of the alignment with OT and not think PEO. So that's kind of why I emphasise them on the slide there. And just in terms of the gains and losses and this constant trade-off between, do I adapt to fit in, or do I invest extra energy in terms of being able to have the space to be my authentic self? And Rebecca talked about the amount of effort that people put in to participate in occupations that are meaningful to them. But I guess that's also relevant in terms of our context for work. So yes, in terms of the service users that we're working with, but also in terms of our colleagues. And yeah, absolutely.
So just quickly to say, I'm sure you're all aware about the Equality Act, and there's 9 protected characteristics, and gender reassignment is one of them. And it's, as Hannah said at the beginning of the talk, it's a moot point how much non-binary people are covered by legislation and laws, because when this was written, it was very much seen as kind of very binary, understanding someone who transitions from male to female, female to male. And yes, whether there's kind of mixed views on whether it includes non-binary people. And this is what, the gender recognition at consultation was all about. It wasn't the alarmist things that, you read in the right-wing press or even the left-wing press sometimes about, kind of females-only spaces and what that means. It was simply about protecting and acknowledging the rights of all trans people. And I don't think any of us here would directly discriminate against anyone who's transgender, but I think we need to think about our interventions and whether we could be indirectly discriminating someone by giving someone a stereotyped intervention to do. So, if you're thinking working in inpatient female ward, what does it mean to run a women's group? What is the activities that you're doing there? Are they inclusive, exclusive, the subjects of conversation, etc.? But research shows, there's not a huge amount of research, but research does show that we can lean upon gender stereotyping when we do kind of think of interventions, goal setting, etc. So that's something to be mindful of. Thanks, Hannah.
So a little bit more kind of reiterating context, which I drew upon earlier. Those statistics on the slide there come from the Stonewall Trans Health Report, but those challenges and disparities are corroborated elsewhere. A good kind of resource for some of those figures, if you can say a good resource because they're hideous figures, is the LGBT Foundation's Hidden Figures Report. But again, all of these things emphasize why this is all of our responsibility. You know, 41% of trans folks have experienced a hate crime. 48% don't feel comfortable using public toilets. It's a toilet. 25% have experienced homelessness at some point, and that can be because of rejection, abuse, family dynamics, you know, and that trade-off again between authentic self versus adapting to fit in. And again, there 28% have experienced domestic abuse from a partner. And, you know, both Rebecca and myself have reiterated the relevance to clinical practice throughout, but just kind of to further emphasise that 41% of trans folks say healthcare staff lacked understanding of just specific trans health needs. And if you think, you know, we go to a healthcare professional and we expect them to be an expert, not kind of discarding a unique experience within that, but, you know, we anticipate some level of knowledge and understanding, yet 41% of trans folks are saying that their experiences of general healthcare staff lacked understanding of their specific needs. Equally, they're around people accessing social services, facing discrimination, a lack of appropriate health and social care training around trans and non-binary issues. And therefore, you know, the line at the bottom there, the NHS is letting down trans people and it's failing in its legal duty under the Equality Act. Back to you, I think, Rebecca.
Sorry, yeah, just quickly going to talk through some legislation. We've talked about the Equality Act, but the Gender Recognition Act is a really huge bit of legislation which came in 2004, and it was legally recognised gender identity in a binary sense again. So again, doesn't cover non-binary identities. It's about who have transitioned from one gender to another. It doesn't require people to medically transition, i.e. take hormones or have surgery, but you have to kind of live for 2 years in your chosen gender identity and have a diagnosis of gender dysphoria, which is terribly pathologizing. And, you know, oh gosh, I think it's 2018 or so, you know, there was this big review of the Gender Recognition Act and huge amount of lobbying by, you may have heard of the term TERFs, trans exclusionary radical feminists, and hand in hand, kind of the right-wing press made this out to be, you know, vicious attack on kind of the safety of women, but it wasn't. It was about protecting trans people, and that's all it was, you know, about the right for people to kind of self-determine their gender identity, which we all should have the right to do. And I'm going to talk now, if we could go to the next slide, Hannah, about why this bit of legislation is so important. So it protects somebody, it gives somebody a gender recognition certificate, which is their authentic gender identity on their birth certificate. Now, as healthcare professionals, we can't disclose to anyone else someone's gender history we shouldn't ethically anyway, but if they've got a gender recognition certificate, it's a criminal offence to do this, unless someone is made the disclosure is to another healthcare professional, it's for medical purposes, and the person you're talking about has consented to this or cannot give consent, and it's in their best interest to do that. So basically the message is, not to gossip or talk about someone's gender history without their consent. And is it relevant? I would strongly encourage everyone to, if you have any kind of questions about how this relates to your work, to look at your trust guidelines, because I don't think all trusts have this covered, but most do now. And a very good example of this is SLAM's document on kind of working with trans and non-binary people and their carers. Thanks, Hannah.
Okay, then, so moving on to some takeaways, I guess. Re-emphasising that PEO model and that trade-off between the losses and gains. As healthcare professionals, we're part of someone's environment, and as OTs, we're experts in the impact of that environment as a barrier or facilitator to occupational engagement and therefore well-being and quality of life. And in our work, in every context, the interpersonal environment is so, so important. We're reliant on creating an interaction that's one of trust, respect, confidentiality. We're reliant on appropriate, inclusive communication that's skilled and underpinned by that relevant knowledge and expertise. And we know from the evidence that Rebecca and I have discussed here today that, that a lack of knowledge and understanding, whilst it isn't blatant and overt discrimination, can be all it takes for someone to avoid accessing that healthcare and support that they need. We also know the environment to be multifaceted, so the cultural, organisational and systemic environment in terms of team and trust communications, admin processes, correspondence, it's kind of no assumptions there. And the physical environment, is it binary gendered? Does that pose a barrier to someone's engagement or their safety? And again, relevant for our patients, our colleagues, our students, humans. All of those things matter there in terms of that contact there and then with that person, but also in terms of being informed of and having some insight and understanding of the context and experiences that that person might be bringing into that interaction with you or into work as a colleague, as outlined through the whole of this session, really. Kind of urging people to be that change, be that opportunity for someone to regain trust in healthcare, to feel validated, to seek and access support, to increase comfort and participation in occupational experiences and contexts, and ultimately being true self, which we know influences well-being. So I've just kind of summarised some bullet points there on the slide. I think it's important that we don't just do these things, but we understand the why behind the do, and we do them consistently. So inclusion as a whole, it's all our responsibility, and the standard we walk past is the standard we accept. Emphasising then that we are part of someone's environment, therefore we can influence that. And consistency regardless of who's in the room. Pronouns. Anybody who's had any interaction with me over the last couple of years, I've mentioned pronouns over and over again because it's really simple. Introduce yourself. Hi, my name's Hannah Spencer. My pronouns are they and them. It's never compulsory. It's always a choice, and the answer might change in terms of someone exploring their identity or someone perceiving safety. But if you're cisgender, if your gender identity aligns with that sex you assigned at birth, you're not going to have any hesitation over your pronoun. It's a simple, easy action to communicate that level of understanding of trans and non-binary inclusion. I've mentioned the environment again there, a little bit repetitive, but including the interpersonal environment, no assumptions, gender inclusive, and using the terminology that person uses themselves. And trans broken arm syndrome, often talked about, that's kind of the inappropriate blaming of something on a gender identity. So I talked earlier about people being unable to access mental health support, for example, because it's misperceived that the reason they're seeking mental health support is because of their gender identity, or it's called trans broken arm syndrome because somebody, say, presenting at A&E with a broken arm, and this is as ridiculous as it sounds, but it's true, and that being blamed, oh, you got broken arm because you're trans, you know, inappropriately relating things back to gender identity. And that relates to kind of inappropriate questioning and curiosity and an expectation of patients to be educating healthcare professionals. Such, you know, it's not good, is it? So again, reiterating some of the best practice tips that Rebecca and myself have kind of sown throughout this presentation. Check your trust or organisation guidelines. Ask the person how they'd like to be known and what pronoun they'd like to use, and ask it consistently. Particularly, you know, it might take someone a while to build up that trust in you, to feel that they're able to share questions about their gender identity or their true, authentic identity. So if we're asking consistently anyway, that kind of reiterates that safe space for them to be able to do that. Think about trans-friendly forms and the sensitivity of assessments. Again, like Rebecca said, not gender stereotyping interventions and occupations. Recognising and challenging our own biases and assumptions on a day-to-day basis as well. And what I just said there about, is it relevant? Don't ask unnecessary questions. So actually, is someone's gender identity relevant to what you're actually doing? Do you need to ask about it? And then we've got a few slides about resources for further learning and further reading. Transgender healthcare, caring for trans patients, is a MOOC, a massive open online course that's hosted on FutureLearn. It was devised by a group of healthcare professionals and academics at St George's University in London, which included trans folks in that team. And I reviewed the course from an OT perspective, so there's kind of clear and blatant links to OT, hopefully woven throughout the course. So that's free to access and a good resource for anybody to access there. In terms of reading, there's tons and tons of reading. I've obviously credited Rebecca's most recent publication there on the slide, but the row of books there on the top are all by trans or non-binary authors, and vary in terms of their complexity. So if this topic area is kind of completely new to you and you just want to kind of learn the basics, I guess, then the Juno Dawson book there, What's the Tea, is a really good read, easily accessible. Similarly, the documents there on the bottom of the screen, some of the documents that we've referred to throughout this presentation, easily accessible via a quick Google search.
So we thought we'd flag up some kind of resources that are out there. You know, if you're working with trans, non-binary clients, patients, you know, you're not expected to be an expert, but there are plenty of trans LGBT-led organisations which are, and there's the kind of nationwide Switchboard is a LGBT+ helpline, which is a good protocol. When I volunteered there, we would quite often get phone calls actually from healthcare professionals saying, could you tell me where I can get information on this or this? And it's a good place. It's not a counselling line, but it's a good place people can call and talk about, you know, their feelings around their gender identity. And there are some amazing organisations like Mermaid, Gendered Intelligence, which are trans-led and do training on kind of trans issues and have support packs out there. And I think, you know, something we've already talked about is this kind of absolute panic that people can have, fueled by the media around working with a young person who defines as trans or non-binary, and Mermaids has lots of information, as does Gendered Intelligence and Stonewall, about kind of supporting that child and young person. And then of course there's the LGBTQIA plus OTUK network, which has been going for about a year or so, and that's for us OTs and academics and students who define as LGBTQIA plus.
And I guess I think Gendered Intelligence have recently revisited and republished their documents around advice for young trans non-binary folks. It's called Knowledge is Power, and again it's aimed at kind of younger folks, but it's a really good kind of insight into kind of starting that learning. Yeah, I think that's all I wanted to say on that one. And then we've included a pretty extensive reference list there for everyone, and I believe the slides will be made available afterwards. Cool. Thank you.
Thank you, everyone, particularly on such a hot day. Well done.
Wow, thank you. Thank you so much, Rebecca and Hannah. That was really insightful for me. Every day is a school day. You know, I know I'm an EDB manager specialist, but I'm learning a lot as well. So thank you so much. That was really thought-provoking presentation.